Good afternoon. Last time we discussed the various causes of heel pain in the hopes that the general public, meaning you, would be able to better differentiate what their heel pain problem was and not just assume that it was plantar fasciitis. Today we are going to discuss in further detail what plantar fasciitis is, and we're going to use our trusty foot here to exemplify where plantar fasciitis hurts, what it actually is, and thereafter briefly what we do for it. So plantar fasciitis refers to, as I mentioned in the last discussion, pain along the bottom and inner or medial side of the heel. The plantar fascia itself is a ligament that runs from the ball of the foot all the way through the arch, and it attaches back on the heel, which generally up underneath the skin is shaped like so. So that ligament actually comes in and attaches to the underside of the heel. It's a very broad ligament. It runs across the entire width of the bottom of the foot. Every time we step down, the body absorbs shock by flattening of the arch, and in doing so the foot elongates, and much like a rubber band, this tensile ligament gets stretched and most typically will begin to get inflamed right about up underneath here. Most patients will describe a bruising sensation, most notable when they get up from rest or get out of bed in the morning. So in order to understand what we do for plantar fasciitis, one must first understand biomechanically the two things that are causing it are the flattening of the arch and very subtly, but not insignificantly, the tightness in the calf musculature up here. I have yet to meet a plantar fasciitis patient that does not have tightness in their calf muscle, and it's most notable when their knee is straight and we try to flex the foot up. That tightness through here does not allow us to properly transmit our weight forward. So the body, again being its wonderful compensatory machine, compensates by rotating the toes out and by rotating the pelvis internally, which causes the arch to flatten and creates strain on the plantar fascial ligament right at the underside of the heel. So I tell everybody when we treat this, to treat it effectively, our protocol is to do three things. Generally that involves stretching of the calf musculature, that involves supporting the arch, and it involves taking measures to adequately reduce the inflammation, which by the way is synonymous with the pain. When you come in, obviously I give a more detailed explanation of this. I would encourage all of you with plantar fasciitis to make an appointment. Be happy to go over our protocol, dispense our stretching exercises, as well as a night splint to sleep with, and again review the causes and the treatment process. Thanks very much. Our next episode we will shift to the back of the heel and talk about what we term in medical terminology retro or posterior calcaneal heel pain.